come to a comfortable seating position. Make sure your environment is quiet and free from distractions. Today, we'll be focusing on pain. Rather than trying to take our mind off the pain in this meditation, we'll be bringing our awareness right into the painful sensation and staying with it. First, make sure your body is in proper position. Make yourself as comfortable as possible, but stay alert. You may keep your eyes open or closed. Begin by taking several deep breaths and gently bring your awareness to the sensation of breathing. With each inhale and each exhale, allow your body to settle into a deeper state of relaxation. As your body becomes more at ease, your attention becomes more focused on this present moment. Now, allow your attention to range throughout your body and let it alight on that part that seems most in distress at this moment. It may be an area of mild discomfort or a part that seems to be in a fair amount of pain. Once you've made your selection, stay with that area for the remainder of the exercise. Let your awareness approach the area slowly and cautiously. You may be a bit apprehensive about focusing your attention on this location. Sometimes we are afraid to look at painful places too closely for fear that we might be overwhelmed by unpleasant sensation or by frightening thoughts about what might be causing the pain. If you detect this sort of resistance, softly note it to yourself. Let it go and proceed. Your purpose is simply to observe. You're making no judgments about the pain. You have no intention to change it in any way. You neither want it to leave nor to stay. You merely want the pain to be what it is and to give it the attention it deserves. Let your attention come as close to the pain as possible. If your resistance to getting close becomes too great, you can always escort your awareness back to the breath and try later. When you're ready, give the painful area your full awareness and observe it with kind-hearted curiosity. Silently note your observations. Try to define the region that feels painful. Try to gain a sense of the contours of the painful area. Observe how deeply the pain goes into your body. Imagine a three-dimensional model of your pain. Then, consider how you might describe the quality of your pain. Pain is experienced in a wide range of ways, and its descriptive vocabulary is immense. Choose the words that make the most sense to you. It may be, however, simply indescribable. Now, imagine the dynamics of the pain. Most of the time, pain is changing, although it's not always easy to detect this change. Consider if the pain is fluctuating in its intensity. For the next few moments, simply keep your awareness on the painful area and remain keenly observant of the sensation you feel. This time, avoid labeling the sensation and simply feel them. Now, try to become aware of your awareness of the pain. That may sound a little paradoxical, but it can be done. Simply watch yourself as you're observing your painful sensations. As you do so, see if your awareness is in pain. If you can become an observer of your own awareness, you may discover a place where there is no pain. Dwelling in this awareness may help mitigate the painful sensation in your body. You are no longer a person in pain, but someone observing a person in pain. Being in this observing space may allow you to see that your pain is not you. And you are not your pain. Staying in this particular place of awareness is not easy, and it takes practice to do so, just as it takes practice to remain focused on the breath. Now, let's return to the breath and draw this exercise to a close. Let your attention come back to your breathing for a few moments. Reflect on your experience with the practice we've just completed. Did you notice any initial resistance to turning your attention to the painful area in your body? If so, what thoughts or emotions lay underneath that resistance? If you were able to give your pain a fuller attention, how did your mind respond?